Bismillahirrahmanirrahim. Hello guys, and today we are going to discuss about the calcium, the hypercalcemia and hypocalcemia. So first let's talk about the hypocalcemia. Hypocalcemia. So what is the normal calcium levels in the serum? It's approximately from 8.5 to 10.2 to be more specific, and the units are milligram per deciliter, or we can say milligram percent. Okay, so in case of hypocalcemia, what value can lead to hypocalcemia? It's less than 7 milligram percent can contribute to development of hypocalcemia. And what are the manifestations? Hypocalcemia can result in the development of tetany. And why the tetany occurs? Because it results in hyperexcitability of the neurons. The neurons went into hyperexcitable state, right? So that result in the development of tetany, and tetany is the contraction of the muscles, okay, the skeletal muscles. And in case of hypocalcemia, the death is mainly due to laryngospasm, okay. The death is related to laryngospasm, okay. It's very dangerous situation in which the calcium levels decreases so low that the patient can die, okay. It result in laryngospasm. The treatment for hypocalcemia is we can give the calcium supplements, and more specifically we can give intravenous 10% calcium gluconate, okay. It's the treatment of choice in case of hypocalcemia. We can give calcium gluconate 10% IV intravenously, right? So this was hypocalcemia. Let's talk about hypercalcemia. And hypercalcemia is the condition in which the calcium levels of the blood rises to more than 13 milligram percent, okay. They are more than 13 milligram per deciliter or 13 milligram percent, and this is also known as the hypercalcemic crisis. The death in case of hypercalcemia resulted due to systolic arrest. Death result in hypercalcemia due to systolic arrest, and the death due to diastolic arrest occurs in hyperkalemia when there is increased amount of potassium, mainly 8 milligrams. So it results in the diastolic arrest, and it can contribute to the development of death, mortality, right? Hyperkalemia is related to diastolic arrest, and hypercalcemia is related to the systolic arrest. What is the treatment in case of hypercalcemia? The serum calcium is rising, so we need to manage that, right? We should administer normal saline. Normal saline is 0.9%. Okay, we need to administer normal saline 0.9% to ensure hydration, to increase the hydration so that the blood volume is not disrupted, right? Normal saline is the first line of treatment. The second is we can administer furosemide. First of all, for example, if a patient is developing hypercalcemia of 13, right, so we can give normal saline, and we can increase the hydration until the calcium level decreases to 12 milligram percent. After that, we can adopt the other strategies of the treatment. For example, we can administer furosemide. Furosemide is a loop diuretic, okay. It's a loop diuretic, and the function of furosemide is to increase the calcium loss in the urine. It causes hypercalciuria. And that's exactly what we need in case of hypercalcemia. The blood calcium is rising, so we use the drug that increases the loss of calcium into the urine, and furosemide is administered IV, okay. It promotes hypercalciuria, and we are relieved because the calcium is lost into the urine. Contraindicated drug is thiazide because thiazide is also a diuretic and furosemide is also diuretic, but furosemide is beneficial. But thiazide is contraindicated because it causes hypocalciuria. It prevents the excretion of calcium in the urine, and we do not want this. We need hypercalciuria instead of hypocalciuria. So thiazides are contraindicated. What is the drug of choice? Furosemide is okay, thiazide is contraindicated. So what is the drug of choice in case of hypercalcemia? The drug of choice are bisphosphonates. To be more specific, it's ibandronate. Ibandronate is a bisphosphonate. Okay, the class of the drug is bisphosphonate. And what is the function of bisphosphonates? Bisphosphonates, they inhibit the bone resorption. Bisphosphonates, the function of these drugs is to inhibit the bone resorption. Bone resorption means that they do not allow the bone to be resorbed, and they do not allow the calcium to be released from the bone into the blood. So they inhibit the bone resorption. In this condition, they are preventing hypercalcemia, uh, and in other words, they are treating the hypercalcemic conditions. Okay, they inhibit the bone resorption and they reduce the calcium release into the blood. What other strategies we can apply here? We can give a nasal spray of calcitonin. And what is calcitonin? Calcitonin is also a hormone released by parathyroid gland, right? Calcitonin decreases the calcium levels of the blood, decreases serum calcium, and it promotes the uptake of calcium by the bones. It causes the calcium to move into the bones. The function of calcitonin is opposite to the parathyroid hormone. Parathyroid hormone increases the calcium in the blood, and calcitonin decreases the calcium in the blood, and that's exactly what we need here. Steroids can also be used. What kind of steroids? The name is hydrocortisone. Hydrocortisone. What is the mechanism of action of hydrocortisone? It inhibits the production of calcitriol. What is calcitriol? It inhibits the production of calcitriol. And calcitriol is the active form of vitamin D, right? Calcitriol is active form of vitamin D, and this vitamin D will cause the calcium reabsorption in the intestine. But using the hydrocortisone, we are inhibiting the production of calcitriol, means that there will be no vitamin D and there will be no absorption of calcium from the intestine, and we do not want the calcium to be absorbed, right? So hydrocortisone are doing their job. Hydrocortisone are not only used for hypercalcemia, they are also used in case of vitamin D intoxication. Vitamin D intoxication means that the level of vitamin D is increased in the blood intoxication, and we need to reduce the vitamin D. Exactly, calcitriol needs to be reduced. That's why we are using the hydrocortisone. The next thing that hydrocortisone treat is known as sarcoidosis. It's like non-granulomatous disease. It's non-infectious granulomatous disease. Sarcoidosis. These two conditions are treated by hydrocortisone. What is sarcoidosis? Sarcoidosis is a non-infectious granulomatous disease. It involves the collection of inflammatory cells known as the granulomata. So they are accumulate in the different parts of the body and result in the manifestation of sarcoidosis. And vitamin D intoxication can be due to gym users because they are in a lot of vitamin D supplements, so their blood levels of vitamin D shoots. So that's why we need to give them hydrocortisone to inhibit the production of calcitriol. In turn, hydrocortisone can also be beneficial in case of hypercalcemia. So this was for today, and next lecture we are going to discuss about magnesium like hypomagnesemia. Till then, goodbye.